Hi, this is Rizwan and you're watching the Indian Weekender. Today we will be bringing COVID-19 news update from our neighbor Fiji. That too, like the rest of the world, is stuck with the COVID-19 pandemic. As we know, there are 18 total cases in Fiji right now. 3 have been recovered completely. Talking to us a little more about how is the situation, talking to us more about how is the situation there live. We have Dr. Rajesh Maharaj, who is located in Suva, Fiji. He is on the front line, and we would like to know more about Fiji's situation right now. How is Fiji fighting with COVID-19 right now? Hi, Dr. Rajesh. How are you doing today?
I'm good, thank you very much.
Dr. Maharaj, so there are 18 total cases reported in Fiji and 3 recovered. So how is the situation in the country right now with regards to COVID-19?
Situation is pretty stable. The government has taken some very stringent ways to prevent the spread of the COVID-19 virus, and a very appropriate way the government is handling the situation. And at the moment, Suva was on lockdown up until last Friday, but things have normalized now, and people are free to move around. And of course, there is no gathering around, not more than 3 people. People are still taking or have been asked to take precautions, and people are taking heed of the advice. And the curfew is in place. That remains.
Are these in the rural areas or the urban areas?
In Suva, it was in the urban area, just 3 miles from Suva city, in a place called Nambua. It was an informal settlement, and there were just 2 cases, and that settlement is still under lockdown, and people have been isolated, and people are not allowed to move in and out of that place for another 14 days. But it is well under control. And the other places that has been the source of infection has been in Lambasa. There was a person who traveled from India to Singapore, and then Nandi, and then Suva, and then to Lambasa. So he is very much isolated in Lambasa. He has tested positive, and there was another guy who traveled with him, and he was tested, but for the first 14 days he was negative, and then after that he tested positive. So he is in isolation in one particular village in Lambasa, or in the other major or other big island of Fiji. It's called Vanuatu. So he is that area has been barricaded.
Right. I would just like to add and tell our audience that we have been trying to get in touch with Dr. Rajesh Maharaj, who is working on the front line at his private clinic over there. And he has been difficult to reach out because he has been working on the front line, making sure that safety is adhered over there, and he's looking after patients. So that has been kept him really, really occupied. Thank you so much, Dr. Maharaj, for joining us. Continuing with our interview, how is the environment there in terms of how are people feeling? Are they scared? What's happening, or are things well in control amongst the community? I'm speaking.
Certainly, there is a uncertainty, amongst our people, and to some degree of fear as well. Initially, there were a lot of fear, but that has kind of calmed down a little bit. There was panic buying as well. But now things are stable. Things are very much under control. All the cases have been isolated. The hotspots have been identified, and contact tracing has been done. So the government officials and the designated doctors are very much in the front line, and the accident emergency doctors have also been briefed as to regards to if anybody who is having any symptoms suspected of coronavirus, and then they are being tested. So so far things are quite stable, and we have so far 18 positive cases.
Right. In terms of lockdown, which are the places that have locked down? Is the whole city put into a lockdown, or only small clusters in areas where there have been cases identified as positive?
Okay, the entire Suva Nosori corridor. I don't know whether you have been to Suva or no.
Hmm.
But Suva city, from Suva city to Nosori town, that is where a majority of the population is spread here in the central division.
Yes.
So beginning from Lemi, when you're going towards Nendi, there's a small town called Lemi. So
Hmm.
beginning from Lemi right down to Nosori Bridge, that area was basically locked down for 2 weeks, and it has
Yes.
opened now. And as I mentioned, in Lambasa, where this case, where the positive case leave place called Sosoa, that place was locked down and is still under surveillance. There's a small village in Draketi where the second case, positive case, who traveled with this particular man from India, he is now under lockdown, and the whole of that catchment area is under lockdown. But otherwise, other places, the security forces are allowing movement in Lambasa. So Lambasa is okay now. Suva is okay now. The lockdown is over. Lautoka was the first city to go under lockdown when the very first case was detected in Fiji. That was almost a month back. And
Right.
after 2 weeks of lockdown, Lautoka has also opened up. So basically, all the towns and cities are opened up now, and people are free to move around. But the people are advised to keep up with the social distancing 2 meters apart as much as possible, and people are advised to stay at home as much as possible. And
Yes.
a lot of corporate organizations have requested their workers to work from home. So
Certain.
the entire country is taking a lot of precautions, which is really,
Right.
really very good, and we appreciate the efforts of the authorities and efforts of the corporate
How
organizations.
is the testing being done there? Do you have mobile testings vehicles as
The
well who
testing
are
is
going to
the
rural areas?
Yeah, the testing of suspected cases or for contacts, that is handled by the task force, the COVID-19 task force and Ministry of Health, and the testing is done in a particular lab in Suva. It is called Mataika House, and
Mhm.
that is the virology lab, and that's where all tests are carried out for different viruses.
Right.
So that is where testing is being done in Tamavua virus lab.
What about the testing of the patients? If there are any suspected cases, are there mobile teams who are going with their kits to do the
No,
testing of
no,
the people over there?
there's no mobile team, but there are
Camps?
staff who are going and collecting blood, and they're bringing the blood back to the virus lab, and that's where the testing is being done.
Right. So with 18 cases over there, what's closed and what is open?
At the moment, in Suva, all the businesses are open.
Mhm.
Essential services and every business is open. Likewise, in the rest of the country,
Mhm.
except for the uh, the the few areas, two or three areas where these active cases have been found. These areas, which are like small catchment areas, they have been barricaded.
Right. So what is next for Fiji in terms of fighting with COVID-19?
Well, the government has declared an emergency from last week until mid-May, I think. So we are looking at that, until mid-May, or it could be early May. The
Yes.
curfew is going to continue, and the restrictions, the the restriction of movement is going to continue, and social gathering is not allowed. Not more than 3 people. In funerals, only 20 people are allowed to attend funerals, and the borders are closed. There's no flight into the country. There's no flight out of the country, except for flights bringing in medical equipment and cargo. Likewise for sea freight as well, except for ships which are bringing in cargo and containers.
Yes.
Otherwise, there's no movement of people in and out of the country, and and the bars are closed.
The bars and the clubs and the sporting clubs,
closed,
these are all
nightclubs
closed.
are closed,
Right.
restaurants are closed, and basically just stay home advice.
Right. So just last question I want before we end the interview. Amongst you, the doctors and nurses and frontline aged care workers who are doing their duty and who are on the front line, how is the feel over there as a doctor, as a frontline worker?
No, the situation, as I said, because the situation is under control and we are taking precautions. We are, in terms of using masks and hand sanitizers and personal protective equipment. So, so there is a little bit of a concern, but we have to take the risk. And for me on a personal level, I am comfortable with what I'm doing. I have to be in my clinic. My patients are calling me and they are needing help, and I'm just seeing a small percentage of cases with fever and flu, but otherwise the other cases I have to see. So we are okay at the moment. The situation is under control, and we feel that we have to do our part, and we have to be in our clinics and treat our patients. But thank God that there are only 18 cases in Fiji, and God willing, there isn't any more. And I'm pretty sure we are able to control the spread of this virus fairly well.
Thank you so much, Dr. Maharaj, for talking to us and giving us the first-hand knowledge and news about what's happening in Fiji. Thank you so much for your time, and all the best. We hope you save more lives over there.
Thank you very much. It's a pleasure talking to you, and my prayers for all the doctors and nurses who are there in the front line in every country, and in particular in New Zealand and Australia, India, and my prayers for our country and for you and for the entire world. Thank you very much.
Thank you so much, Dr. Maharaj.